Well, a friend introduced us in medical school and married now for 46 years. We were in the Indian Health Service together after residency here at VMC, and then we set up a practice in Fowler and raised 2 daughters along the way. Had a lot of adventures professionally and otherwise.
We go back a ways, I think, to residency at Valley Medical Center.
I've known Dr. Sherriffs for quite a long time. I first met him through the UCSF Fresno Alzheimer's and Memory Center. He started working there a little bit before I did in the late 1990s.
I know Alex for many years. He was a faculty person for me when I was in training at UCSF Fresno, but education has been one of the priorities that he and I have both worked on.
Well, we had very broad training as family physicians, and we expected to practice the full spectrum of family medicine when we arrived, and we did that together for a couple of years. But at that point, Alex was getting more interested in teaching, and we had a baby and a preschooler, and something had to give. So he gave up obstetrics after the first couple of years, and I continued doing that, and he, of course, expanded his practice and to include half-time teaching. He's unfailingly positive, particularly in his relationships with other people. He sees the best in everyone, and everyone he touches grows as a result of it.
He was passionate about air quality then, as I was. So with the Medical Society, I call him Sandy, as his friends, that's his nickname to his friends, is Sandy. Sandy and I and David Pepper came up with a pamphlet entitled What Your Doctor Wants You to Know About Air Pollution, which we distributed to people's offices for our patients. We've written editorials to the First of B and also for our Medical Society magazine together about air quality and climate change.
I learned from him a long time ago. He and Joan were recruited to Fowler by the community of Fowler. Their primary care doctor was going to be retiring, and as a community, they had him and Joan come out and interview with them and show them around, and he felt like he can connect with the community, and they took the job and integrated themselves in the community.
He walks the talk, He very fervently believes in clean air, in healthy climate. He enjoys the out of doors, and because he enjoys the out of doors, he wants to protect a healthy environment up there. He's willing to put himself out there at risk of being criticized or shot down. He's courageous enough to present his views, which are very well-based views, to advocate for our patients and our community.
I think the reason that Dr. Sherriffs gives so much to the community is because that's who he is. That's what he thinks about. Without that, he wouldn't be Dr. Sherriffs. I mean, that's why he does it, because he's lived here forever. He's become part of the community, and he likes to give back, and that's what his character is. He always comes to work, and he's always enthusiastic, and he's got a smile and comes up and wants the fist bump, and always has something nice to say, and is always able to take a patient interaction and bring joy to it. So I really admire that, and have, I think of that as a model.
He feels that he has agency. And he likes doing things. He's curious. So that if he sees something he feels he could make a contribution to, he wants to do it.
I consider it an honor to be able to be his colleague, and I've learned a lot from him over the years in terms of ways to interact with patients and families, ways that he supports the families that come through our center, which is probably one of the most important things to do, and yet hardest. Alex, congratulations on this award. It is certainly well deserved, and I applaud you for it.
Alex, job well done. Excellent life. You're I'm proud to call you a partner in family medicine.
Sandy, congratulations. I am you deserve this more than anybody that I can think of, with all the stuff you've done for our community. And so it's about time, right?
Congratulations, my dear. You've certainly earned this.